All right, let's talk about observation of the body colors. So I'm not talking about the tone, I'm talking about the body colors. The body can be either red, yellow, purple, bluish, or pale. Okay, so let's start with red. If there's redness in the lips or the nose or the eyes, or there's red rashes anywhere in the skin, it's either an excess heat or it comes from a yin deficiency. Okay? So if you have red lips, it could be that there's excess heat in the stomach because the lips are reflected in the five element to the stomach and spleen. So if the lips are red, it's an excess heat in the stomach. It could also be a yin deficiency in the stomach if the lips were red and cracked. So that's the difference. And of course, you would have to look at symptoms and as the tongue as well, right? So if there's red eyes, for example, like chronic red sclera of the eyes, it would be that there's probably some liver heat or liver fire that's affecting or heat that's affecting the liver. Does that make sense? So it's kind of our observation skill that we use in that perspective to look at colors, right? Yellow. Yellow palms, I always look at my patient's palm. Yellow palms connotate dampness. So it kind of gives you an idea if there's a lot of dampness in that person. Of course, if there's yellow sclera or the eyes, yellow eyes, that's usually a sign of jaundice, right, which affect the liver. And in TCM, jaundice affects liver and spleen, and there's excess damp heat usually. The nails, if the nails are yellow, same idea, right? It is connotating usually jaundice as well. Oozing skin. So of course, if we see yellow pus, yellows, anything that's oozing and that's yellowish, that's dampness. Make sense? Purple. So purple is always blood stasis. Purple nails would make liver blood stasis because liver reflects in the nails. Purple lips would be more blood stasis affecting the digestive system, especially the stomach. Purple bruises all over the body, right, have tendency to bruise easily. That can come up with a spleen not holding the blood within the blood vessels, which can create bruises. Or if someone has punched you, you have a bruise, and that's blood stasis. It's painful and bruise. Big blood clots in the menstruation, blood during menstruation, also shows purple blood stasis. Bluish color, that's usually an excess cold. So usually a lot of time if we have bluish color, we may have bluish purple because if there's excess cold, it creates a congeal, it stops circulation and can create blood stasis. So it's very often we have a bluish purple together when there's excess cold. So it could be acute or chronic, of course. If you have really, really blue lips, that's usually probably because you're really freezing. So maybe we see kids often, right? Kids can play in the water, in the ocean, or in the lakes, and they're freezing. Their lips are blue, but they still want to play because, they're having fun. They don't even know they're cold. Of course, blue fingers means there is definitely excess yin, excess cold, no circulation. That could be due to frostbite. That could be due to Raynaud's disease, right? So there's a lot of possibilities for that. And of course, pale always connotate a deficiency. And pale can either be Qi deficiency, blood deficiency, or Yang deficiency. Usually, if it's something that is Yang deficiency, you're going to have pale and puffy, like some swelling with it, right? Or some shine to it. If it's a blood deficiency, it will be pale, maybe more on the drier side. And Qi deficiency could be completely pale. So someone that has pale lips, that's usually, it could be a spleen Qi deficiency. Someone that has very pale blood when they have their menstruation. If it's just pale blood, it's blood deficiency. If it's pale pinkish blood that's very runny and watery, that's more Yang deficiency. Okay, so, but no matter what, it's either a Qi blood or Yang deficiency, you need to have all the symptoms and the inquiry, palpation, and all the other methods of diagnosis to figure out which one is more effective. So let's play with what we just saw, right? So if you look at those two actresses, the one on the left is very pale. She's definitely blood deficient. That's very much a pale. Compared to the one that's on the right, she's pale, but you can see it's a very different pale. It's more of with a yellow hue to it. So when there is paleness with a yellow hue, that means there's dampness, right? We said yellow is dampness in body skin observation, and pale is deficiency. So this is usually a kidney and spleen deficiency that obviously creates dampness, because when spleen Qi is deficient, there's always dampness that occurs. So that's the difference between the two of them. Now let's see, what do we see? So this person, if you look at her, what do you see? Red cheeks, that's a yin deficiency, and definitely more reddish lips. Her lips are pink, but definitely dark pink, more on the red, right? So it's either excess heat or yin deficiency, but because of the red cheeks, I would say it's more of a yin deficiency. Make sense? This person, what do you see? Purple, right? Purple eyes, or purple shade around the eyes, purple lips, purple face. Definitely it's more on the purple side, which is more blood stagnation. The lips, I would say, are a bit purple pale, so there could be some blood deficiency as well. We need to look at the tongue to see if it correlates, but there's definitely some blood stasis. Observation of the area of the eyes. So that's interesting. I don't use this in clinical practice a lot, but as you can see, each area of the eye represents or reflects different organ in the body, TCM organ in the body, right? So the one I use the most is the sclera, or the white of the eye, which represents the lung. So if the sclera is really, really red, or if there's issues, then there's issue with the lung, right? Lung heat, it could be. But because it's affecting also the eyes, and the eyes is always the liver, then I would say there's also liver heat. So this is if the red sclera, usually that's lung and liver heat. Give you some idea, right? What I use a lot more in observation is the upper lid represents the spleen, and the lower lid, the stomach. So if it's puffy on the lower lid, there is definitely some dampness affecting the stomach. If it's puffy or heavy on the upper lid, it's a spleen issue. So often, sometimes people have droopy eyelid, the upper eyelid that's droopy. That's usually a spleen Qi sinking. But there's people that also have very heavy eyelid or puffy one, and that's a spleen, and if it's the lower stomach. If there's a little bit of redness on the inner canthus or the inner part of the eye, that is usually heat or fire in the heart. So that gives you an idea, right? All those little observations. So let's put this a little bit in practice. Let's look at circle under the eyes, right? So if we look at those two people, she has definitely black circle under her eyes. He has more purplish circle under his eyes, right? So hers are more black. More black means kidney. It's affecting the kidney. There's a kidney deficiency. Here's a more purple, so that's more of a blood stasis. That's definitely affecting his lower lid area. That's almost purple, so there's got to be something with the stomach as well. Puffy eyelid, like I said, this one, really the lower one, right? You could see that. It's super puffy on the lower part. And so that's dampness specifically affecting the stomach. And this one, if I look at observation, she definitely has a greasy T-zone. So her nose, her forehead is very greasy. So there's definitely some excess dampness or phlegm that's affecting her. And the red cheeks, right? So there's some yin deficiency from the red cheeks, but there's definitely also a T-zone. So she has yin deficiency and some dampness or phlegm. Again, while you do the rest of your diagnosis, you can correlate all this to your observation skills. Okay, so let's look at another eye. This is really red, right? So you can see the inner canthus is very red. So that's heart fire. And the whole sclera is red, meaning that lung has fire or heat and liver has fire or heat. It definitely looks like an infection, right? Which makes sense, which affects liver, lung, and heart in that perspective. This one is jaundice. We could see it, the yellow sclera, very yellow. That's a jaundice that affects liver. Of course, we understand that. Yellow nails. So again, that's jaundice-like, right? It's really bad for the livers. It's really correlates to a damp and heat in the liver, which is usually jaundice. Compared to these nails have ridges and they are very, very, very pale. So that's more of a liver blood deficiency. Let's look at lips, beautiful lips. So I don't know if those are naturals, but I wanted to try to give you an idea. So I wanted to kind of practice. What do you see there for the color? This to me is a purple, pale kind of lip. So it's lips that are lavender. So purple is blood stasis, pale is blood deficiency usually. So that's a blood deficiency and blood stasis, which is very common to see in clinical practice. Those lips are red. We agree, a little cracked, definitely red, right? So if they're cracked, it could be that it's a yin deficiency because they're cracked, so there's not enough fluid. It could be excess heat that's leading to yin deficiency. This one's definitely purple and dry, right? So we have definitely the dryness because the lips are cracked, and the purplish, which makes it blood stasis and some body fluid deficiency or some excess dryness in the body. Those are definitely body fluid deficiency. Super cracked, super dry, as you can see. So there's body fluid deficiency and the lips are very, very pale. So it's either a Qi deficiency, a Yang deficiency, or a blood deficiency. I would say they're a little bit more puffy, so I would say that it could be Yang deficiency, but of course we need more of a diagnosis to be able to continue to do that. All right, observation of the nose in Chinese medicine. We go through every little area. As you can see, a dry nose is usually heat invading the large intestine or stomach. Why not the lung, right? If it's a dry nose, it's the skin that's dry, and usually it's affecting the meridian. And the stomach and large intestine meridian go by the area of the nose. That's why. If we have clear discharge, like runny nose, post-nasal drip, and it's just water coming out of your faucet of your nose, that is definitely excess cold. If we have yellow discharge, that's excess heat. Okay, so remember that yellow is dampness on the body, on the skin, but not in mucus. Okay, yellow in mucus or on the tongue coating will be more heat. That's the thing that all my students make mistake. Yellow palm would be dampness, right? Yellow color on the skin, like oozing discharge, is definitely a bit of dampness. But if it's discharge of the nose or mucus, it's always heat when it's yellow and it's cold when it's clear. Okay, let's not mix them up. A blue nose usually affects the stomach or the large intestine and is creating or created by abdominal pain. So it's acute, usually abdominal pain. And a red nose, like Rudolph the reindeer, is usually lung heat or excess heat in the lung.